Welcome back to the next part of the muscle unit. Muscles that move forearm. Flexor carpi radialis is the first muscle which is originated from the flexor carpi radialis. It is originated from the medial epicondyle of the humerus. It passes obliquely downwards to the lateral side of the forearm. It is inserted at the base of the second and third metacarpal bones. The nerve supplied to these muscles is a median nerve which receives the blood supply from the radial artery, and to this muscle the blood supply is received via ulnar artery. So what is the name of this muscle? Flexor carpi radialis. As per the name, the function is also clear. Flexor is a flexion. So what is flexion? Is nothing but the bending of the arm. So, where exactly these muscle is present from the second name, we can understand carpi radialis. That is carpal and radius. These are the two bones involved in this. Carpals are present in our wrist, and radius is present in the forearm. So the muscle is present near this carpal and radius. We shall see the video regarding the carpi radialis.
Hey everybody, what's up? My name is Becky Fiddler, here to go over yet another muscle functions video of the week with you. So I chose to go over the flexor carpi radialis. Like every other video, I will go over the location, which includes the origin and insertion. I will also go over functions and exercises once we know the location. So to start off, like I said, we'll go over the location and we'll move on from there. So the flexor carpi radialis originates on the medial epicondyle of the humerus. That is that kind of bony area on the inside of your elbow, and it runs down along your forearm and inserts onto the second and third metacarpals. Okay, which is about in there. All right. So now that we know where the location of the flexor carpi radialis is, we can now apply functions to it. It does have weak functions and it does have main functions. So the main functions of the flexor carpi radialis include wrist flexion and wrist abduction. Okay, it is also a weak elbow flexor and it is also a weak forearm pronator. Excuse me. Okay, now whenever the muscle is a weak whatever, that is not the main function. So working that function would not be the best way to work that particular muscle. So for exercises, we want to work the main functions. So we're looking at, again, wrist flexion. So we can do wrist curls, and we can do this with dumbbells, bands, cables, you name it, you can do it as long as the weight isn't too heavy where it strains the wrist. You can cause other medical issues. You could also do wrist hammer curls, okay, and that would be like your wrist abduction.
So that was the muscle which was named as flexor carpi radialis. Now the flexor carpi ulnaris. Only the change is the muscle which is change in position of one of the region, that is instead of radialis it is ulnaris. So instead of radius it is related with ulna. Origin medial epicondyle of the humerus, olecranon and posterior border of ulna. Where it is inserted, pisiform bone, hamate bone, base of metacarpal bone number 5. What is the action? Wrist joint, whereas wrist flexion and wrist adduction is done. Innervation, ulnar nerve C7 to T1, and blood supply is through recurrent artery as well as ulnar artery. Due to its position and direction in the forearm, flexor carpi ulnaris can move the hand sideways as well as flexing it. Contracting with the flexor carpi radialis and palmaris longus, flexor carpi ulnaris produces flexion of the hand at the wrist joint. However, whenever it contracts along the side, extensor carpi ulnaris, muscle in the posterior compartment, their counteracting forces produce adduction of the hand at the wrist, otherwise known as ulnar deviation and ulnar flexion. So, it is compatible to the opposite muscle, that is extensor carpi ulnaris, because it help in the extension process, whereas flexor carpi ulnaris help in bending or extending the muscles at wrist and ulnar region. We shall see the video regarding this. This is a muscle, flexor carpi ulnaris. We can see the origin and this is the insertion. See this video.
Hamate, and the fifth metacarpal bone. The flexor carpi ulnaris origin, it arises from two heads, the humeral head from the common flexor tendon origin at the medial epicondyle, and the ulnar head from the olecranon and the posterior border of the ulna. Insertion, it insert on the basiform bone, hamate, and the fifth metacarpal bone. Action, flexes and ulnar deviates the hand at the wrist. Nervation, the ulnar nerve. The ulnar nerve passes between the two heads of the flexor carpi ulnaris, in contrast to the median nerve which goes between the two heads of the pronator teres. Thank you very much. I hope that was helpful.
So I hope you understood about the flexor carpi ulnaris. This is the muscle. It is originated at the base of the humerus and then it is inserted into the carpal, two carpals and one metacarpal. That is the fifth metacarpal. Next muscle is extensor carpi ulnaris. Origin is lateral epicondyle of humerus, posterior border of ulna. Insertion is a base of metacarpal bone number 5. What is action? Hand extension and adduction. Innervation is posterior interosseous nerve, which is supplied by C7 and C8. Blood supply is through radial recurrent artery, posterior interosseous artery. It has a lot of functions to play. We shall see the functions as well as the structure of this muscle in this video.
Important, the extensor carpi ulnaris arises from a common extensor origin on the lateral epicondyle of the humerus. It is inserted into the posterior surface of the base of the fifth metacarpal bone. The tendon lies in the sixth dorsal extensor compartment of the wrist. The extensor carpi ulnaris tendon has its own fibroosseous tunnel near the wrist. It is the only wrist extensor that lies in its own fibroosseous tunnel. The extensor carpi ulnaris tendon passes through a groove on the ulnar side of the distal ulna. This groove is covered by the annular ligament. The muscle acts to extend and ulnar deviate the hand at the wrist. It helps the extensor carpi radialis longus and brevis in extension of the wrist. The nerve supply is the posterior interosseous nerve. Two conditions are clinically important and related to the extensor carpi ulnaris. One is recurrent subluxation of the extensor carpi ulnaris tendon. The tendon dislocates with supination and relocates with pronation. The subluxation of the tendon is secondary to rupture of the extensor carpi ulnaris sheath and is usually subluxed in a volar to ulnar direction. Recurrent dislocation will have a painful snap over the ulnar dorsal aspect of the wrist, especially during forearm rotation. We have pain with an upward pronation, the tendon relocates. Recurrent subluxation of the
Okay, that was about extensor carpi ulnaris. I have stopped video because the next part of that video was regarding clinical uh, functions. That is not our part. Only the structure in which we were interested. Next muscle is extensor carpi ulnaris. See the video.
Hi guys, I'm Sarah from Somatic Movement Center, and I'm going to explain why static stretching does.
The extensor carpi ulnaris arises from a common extensor origin on the lateral epicondyle of the humerus. It is inserted into the posterior surface of the base of the fifth metacarpal bone. The tendon lies in the sixth dorsal extensor compartment of the wrist. The extensor carpi ulnaris tendon has its own fibroosseous tunnel near the wrist. It is the only wrist extensor that lies in its own fibroosseous tunnel. The extensor carpi ulnaris tendon passes through a groove on the ulnar side of the distal ulna. This groove is covered by the annular ligament. The muscle acts to extend
Okay,
and
it is the
ulnar
same that
deviate
we
the
have seen.
hand at the wrist.
Okay. It has been repeated. Anyway, we shall move to the next one. The next one is the flexor digitorum superficialis. Flexor digitorum superficialis. Flexor, mind well, very important thing is flexor and extensor. These are the two words we are here studying. Flexor is related with the bending of that two bones, bending at that particular joint, and extension is extension. Okay, relaxation. So flexor digitorum superficialis. So digitorum is concerned with the muscle should be present or must have been inserted into the digits. So near the into the fingers. You can see in the diagram also. So what is the origin? Humero ulnar head, in which medial epicondyle of the humerus is the main origin. Coronoid process of the ulna on the radial head, proximal half of the anterior border of the radius, inserted into the sides of the middle phalanges of the digit number 2, 3, 4, and 5. The action is metacarpophalangeal and proximal interphalangeal joints 2 to 5. The flexion takes place between 2 to 5 between metacarpophalangeal and proximal interphalangeal joints. The innervation is median nerve C8 and T1, that is cervical vertebrae number. Actually, it is 7. It should not be as 8. And thoracic vertebra number 1. Blood supply, ulnar artery, radial artery, median artery. We shall see the video of this muscle.
You see, I was talking to one of my friends and asked him, "Buddy, how many streams of income do you have?" He said,
The flexor digitorum superficialis for the ring and the middle fingers lies volar to the index and the small fingers. The flexor digitorum superficialis tendon of the fifth finger may not be present in all individuals. Origin: two heads, a humero-ulnar head and radial head. The humero-ulnar head arises from the medial epicondyle, the common flexor origin, and that is the humeral part. From the medial side of the coronary process, that's the ulnar part. The radial head arises from the oblique upper third of the anterior border of the radius. It's called anterior oblique line. The muscle divides into four tendons to the medial four fingers. The muscle separates and creates a tunnel for the profundus to go through. At the proximal third of the proximal phalanx, the flexor digitorum superficialis is flexed to pass around the profundus. The two slits of the superficialis rotate 180 degrees around the profundus. Then the two slits reunite deep to the profundus in a region known as Camper's chiasma, dorsal to the flexor digitorum profundus. Then they insert into the radial and the ulnar aspect of the proximal half of the middle phalanx. Insertion by four tendons into the base of the middle phalanges of fingers 2 to 5. Action: it flexes the PIP and MCP joints 2 to 5 digits. How about the nerve supply, the median nerve? How about the relationship to the median nerve? After the median nerve passes between the two heads of the pronator teres muscle, it passes deep to the flexor digitorum superficialis muscle, and it appears superficial approximately 2 inches from the wrist joint. In the proximal third of the forearm, the ulnar artery is located between the flexor digitorum superficialis and the profundus. How do you test for the flexor digitorum superficialis? The patient will attempt to flex the involved finger at the PIP joint with or without resistance, while the remaining three fingers are held fully extended in order to eliminate the function of the flexor digitorum profundus. How about testing for the flexor digitorum profundus? You will find the finger lies in a slight extension relative to the other fingers. The patient will have no active flexion of the DIP joint. You will extend all the joints of the finger.
So that was about the flexor digitorum superficialis. Now the extensor carpi radialis longus. Origin is lateral supracondylar ridge of the humerus, lateral intermuscular septum of arm. It is inserted into the posterior aspect of base of metacarpal bone number 2. Action is hand extension, hand abduction. Innervation is radial nerve C5, C8. Radial recurrent artery, radial collateral artery provided blood supply to the muscles. The muscle you can see in the diagram, that is extensor carpi radialis longus. The name given longus because the inserted end is quite long from its origin.
What science says about procrastination. Creating to-do list is not going to help you. Installing
Extensor carpi radialis longus. Origin, lower third of the lateral supracondylar ridge of the humerus. Insertion, back of the base of the second metacarpal bone. Action, extension and abduction of the hand at the wrist joint. Means extension and radial deviation of the hand at the wrist joint. That's why in case of posterior interosseous nerve palsy, the extensor carpi radialis longus causes extension and radial deviation of the wrist. In posterior interosseous nerve palsy, the extensor carpi ulnaris function is lost. Extensor carpi ulnaris is attached to the ulnar aspect of the fifth metacarpal bone, and it neutralizes the radial deviation effect of the extensor carpi radialis longus. Nerve, radian nerve, C6. This tendon is located at the second dorsal extension.
So this was the flexor carpi radialis longus. Next muscle is extensor digitorum. The name of the muscle itself indicate it is extended. It is help in extending the digits. So fully they are present or inserted into the digits. Its origin is lateral epicondyle of humerus. Its insertion is extensor expansions of digit number 2 to 5. Action is metacarpophalangeal or interphalangeal joints 2 to 5. There is a finger extension take place. Innervation is post C7 and C8. Posterior interosseous artery, radial recurrent artery, and anterior interosseous artery supplying blood supply to the extensor digitorum muscle. You can watch this video.
Anatomy of the extensor digitorum communis muscle. Communis means common digital extensor. This is the extensor muscle that all digits have in common. It is a superficial muscle. Origin, lateral epicondyle of the humerus through a common extensor origin. Insertion, extensor expansion of the medial four digits. Innervation, the posterior interosseous nerve. Extension of the fingers is predominantly C7 nerve root. We know 7 will give us wrist flexion and finger extension. Action. The extensor digitorum communis extends the medial 4 digits at the MCP joints and the interphalangeal joints. It also provides some extension of the wrist. Thank you very much. I hope that was helpful.
Now in the next video, we shall study muscles of legs.